This week's Ask Dr. Durie is, how does myeloma affect the immune system, and what can be done to make the immune system work better? Well, the first thing to realize is that as myeloma is developing and growing, it really interferes with the normal functioning of the immune system. And this means that myeloma patients can be susceptible to infection or other kinds of issues that require the immune system to be working well. So the question is, what can we do about that? And the key first point that I want to make is that to get the immune system to work better, the best strategy is to get rid of the myeloma. If the treatment works well and the myeloma is reduced, the immune system will bounce back and recover and function much better. Typically, it does not recover to a normal level, and the immune system in myeloma patients is never functioning at 100%. There's always some impairment of the immune system. And so the key point is that if you want to get the immune system to work better without eradicating the myeloma, this is very difficult. It's a complex system, and it's kind of like tinkering with a very delicate Swiss watch and trying to fine-tune it to work better without getting rid of the problem. And really, this is a very difficult task. And so the treatments which work and allow the immune system to improve are treatments which, one way or another, reduce the amount of myeloma. What has been very exciting recently is that we do have several immune strategies which do reduce the amount of myeloma and do allow the immune system to work better. And this is very, very new and very exciting. And so some examples of this approach are the use of activated T cells, what are called CAR T cells. And these are T cells which are taken from the body, engineered to attack the myeloma, and then given back. And these can produce dramatic benefit in a subset of patients. Another approach is to give an antibody such as elotuzumab, which is an anti-SLAMF7 antibody. And this is an antibody which links the myeloma to natural killer cells, which are called NK cells in the bone marrow. And then these NK cells attack the myeloma. So this attacking and destruction of the myeloma removes the myeloma and allows the immune system to work better. Likewise, another very exciting new approach is to use engineered viruses, which can attack the myeloma and also trigger the immune cells, particularly T cells, around the myeloma to mop up. Two very good examples of that are the engineered measles vaccine virus, which is undergoing trials at the Mayo Clinic in Rochester, Minnesota, under the direction of Dr. Russell. He is also looking at another virus called the VSV virus, which may be even more effective and will work well because there are no antibodies in the blood against this particular virus. And of course, a very exciting type of immune therapy is the class of antibodies which work directly against the myeloma and to some extent recruit the immune cells around the myeloma to attack the myeloma. And those are the monoclonal antibodies against the CD38 receptor on the surface of the myeloma. And these are the compounds known as daratumumab, the SAR compound, and the MOR202. And those are three monoclonal antibodies which work well against the myeloma, reduce the level, and allow recruitment of the immune system against the disease and recover some normal immune functioning. And so the bottom line really is the way to get the immune system to work and to work better is to get rid of the myeloma to the best extent possible and allow natural recovery of what is a very complex system and get it to do its job, both to limit the growth of the myeloma and also to be able to fight infection in a much more effective way for the patient.